My name is Terry Holmberg, and I'm a board-certified music therapist, and I currently teach a course in music therapy at K-State. The title of the course is Survey of Music Therapy, so they get really a broad perspective of what music therapy is and who it's used with and how it's used. One of the things that we study is how music is processed in the brain. Music is a very unique sensory experience in that when we receive music as a stimulus, the brain processes it all over the brain simultaneously in multiple areas and on both sides of the brain. I'll contrast that to spoken language. Your brain is now processing what I'm saying in the speech center of the brain in one localized area. And that's true for most sensory experiences. However, music is not like that. Music is unique in that way. What that implies for us is using music as a therapeutic tool is that often, we're working with people who have disabilities that present in the brain. There's some sort of damage or disorder in brain functioning. And when you present information musically, you can often bypass the damaged area and help the person compensate in other areas of the brain. Well, a typical class session, I try to impart and apply what I'm saying to them about a particular topic and describe it in terms of my own therapeutic experiences. I do use them sometime to demonstrate different therapeutic applications. So I try to make it as hands-on as possible and not just lecture.
My name is Darren Brunson. I am a humanities major. I am involved with the drama therapy program here at K-State. I actually want to incorporate music into my drama therapy. Mainly some of the things that we do are learning how you can apply the different techniques of music therapy to the different populations that we study, such as picture identification, improv, sound manipulation, and focusing on motor skills and how each population facilitate that or handles that.
And as part of the course, there's an opportunity for observation. I provide clinical services to Heflin Stonehouse Early Childhood Lab, where I provide music therapy services to their lab school there. So my students also get to observe my work as part of the course.
The most central part of the class that I've found is the observations, where we go to Stonehouse and we observe the therapist or instructor in that setting. I think that is what really translates. It takes what's in the classroom and brings it to how you'll apply it in the future. And for me, for drama therapy, it really translates because it's interesting to see how it's done with music therapy and how I can incorporate that within the drama therapy arena.
I really want them to come away with a basic knowledge of what are the elements of music, what is it that's special about music that makes it an effective therapeutic tool. All undergraduates and graduate students can take the course. I recommend that people who may encounter work with a music therapist to take it, especially those who are going to be in the educational professions or the medical professions. They're often going to have access to a music therapist. So it's really nice for them to understand what a music therapist does so they can take advantage of that.